Hello, my name is Yejin Hong. I'm a medical student in the University of Calgary, and our team is here to discuss osteogenesis imperfecta. Endocrinology is a study involving hormones that travel systemically and most of the time affect the entire human body. And one of those hormones is called parathyroid hormone. This is part of the strict regulation system of the calcium levels in the blood. Systemic disorders affecting this calcium level in the blood can affect the bones as well as the eyes. Osteogenesis imperfecta is a congenital disorder of a connective molecule called type 1 collagen. There are generally imperfect bone formation, and easy fractures occur from very mild trauma or seemingly spontaneously even. Osteogenesis imperfecta can cause a blue hue to appear in the sclera of the eye. The sclera is the outermost layer of the eye and is what we commonly call the whites of the eyes. This layer can also get irritated during any inflammatory diseases, and the red vessels then may appear highlighted in the background of white. Because osteogenesis imperfecta is a congenital syndrome, this disease is passed down in an autosomal dominant inheritance pattern. The locus of the mutation is located on chromosome 17, arm 21.3 all the way to 22.1, and the gene COL1A1 is located here. There are various types of osteogenesis imperfecta, and the presentations may vary generally according to the type of the disease. For type 1, since the infant begins to walk, fractures will be common, and the sclera will become thin due to a lack of normal collagen 1. Therefore, it gives off a bluish discoloration. Facial appearance overall will appear triangular with enlarged head or macrocephaly. Joints will be hyperextendable and muscle tone will be diminished and skin quite thin. Type 2 version of this disease includes short limbs, numerous fractures as well, and micrognathia, which is small chin. Blue sclera also occurs in this type, and abnormal small lungs and respiratory insufficiency can also be detected. If there is a coexistent yellowing of the sclera or scleral icterus, this sclera together with the bluish tinge from osteogenesis imperfecta and yellow from the scleral icterus may overall appear green. Type 3 also probably will present with multiple fractures, and scoliosis and kyphosis are included in this type. Basilar impression and blue sclera also will present in type 3. Frontal bossing turning into triangular facial appearance and micrognathia will be apparent in type 3 osteogenesis imperfecta. Lastly, type 4 osteogenesis imperfecta presents with easy fractures and fragile bones. Bone malformations may appear as a sign also. Blue sclera, triangular facial appearance, or other findings. Among kyphoscoliosis, hearing impairment, as well as teeth that is brittle and discolored. This is also categorized as dentinogenesis imperfecta. Differential diagnosis of osteogenesis imperfecta can include hypophosphatemia, achondroplasia, which is a collagen connective tissue disease, osteoporosis and osteopetrosis, and rickets. So take a complete ophthalmic history from the patient, including the details of any fractures or bruises for the overall history beyond ophthalmic. And if the patient is a child, make sure to have time to interview the child separately for any signs of non-accidental injuries. This will help the child be honest and discuss any instances of domestic abuse if there is one. Slit lamp exam should be done with the attention to conjunctiva and the sclera. Some investigations that can be done include genetic testing with the blood sample, DEXA scan for the bone density, and these may require skin and bone biopsy as well. Treatment of osteogenesis imperfecta includes hydrotherapy, exercise and physical therapy, rodding, which are the placement of metal rods surgically within the long bones to reinforce them, as well as surgery to correct any severe malformations. So hopefully through this presentation we were able to demonstrate that osteogenesis imperfecta represents a link between the ophthalmology and endocrinology. This is a summary slide of everything we have talked about with regards to osteogenesis imperfecta. And here is the reference from which we pulled the information for osteogenesis imperfecta. And this is for the pictures that we have used in this presentation. So thank you for watching this video.